For me, technology is very, very important consideration. It's, do you want to go to somebody who's working with stuff from 50 years ago? Technology really has changed, has allowed dentists and dentistry to do so much more. You really need to be able to take advantage of the new technologies out there. Unfortunately, there's so much new technologies, and they can be very, very expensive. It can be intimidating. It can make you not do anything, or be very, very slow in making decisions. And that's the reality of it. Is you just have to be always on it, looking at things, making decisions. And I'll give you examples. Is an old technology is something like magnification, which is continuously upgraded, but it's sort of like cooking. Sometimes the nicest recipes are the simple ones. This is really the same thing with magnification in dentistry. It's probably the most important thing, is because that means how well do you see. And I assure you, when you're looking inside somebody's mouth, even though we've got these lights from outside or we have headlamps on, there's crooks and crannies that you just can't see. And we're using a mirror, but when you start incorporating more and more things like a microscope, what it's going to do is it'll give you technology so you can see. No matter if you can see your mirror, you can see whatever you're trying to look at. You can zoom in so much closer than I could ever. So often I'll be working on something. I'll say, yeah, with my 4.3 loops, which are, most people would be just about throwing up wearing them for about a minute because it's a lot of magnification. I'm used to that. 4.3 loops, that looks really good. Nah, but I'll check that. And I use my microscope, and I'll say, no, yeah, I gotta fix this up still. And because you can just see better when you can, and it's like if you can see it well, then you can fix it. So that's the most simple, most basic type of technology, and everybody in the office should be using it, from hygienists, and of course the dentist, and the dentist using the microscope, but the hygienists, when they are actually able to use their loops, remember, you're talking about calculus, or that's right by the side of a fuse, almost to the side of a tooth by the gums, and you're trying to flick it off. Well, to be a quarter of a millimeter off, now you're pinching the gums and you're causing a little bit of bleeding, which then makes it harder to see, and it pinches. But you can't fault somebody for being a very, very, very small amount if they're using their eyes. That's why you use magnifications. You can see that, and then it makes it A, more comfortable for the patient because you don't pinch them as much, and B, you can just do a better job because he can see it. So if you're asking me things like what's important for a new patient, if you're looking for a dental office, make sure that they'll listen to you, that you have people who will listen to you. Make sure that they've got a handle on technology, and most important first place to look is magnification.